Hello everyone. So today's topic is thyroid gland. So today we will discuss about thyroid gland. Major headings are first we will discuss introduction. So in introduction, it is the largest endocrine gland, largest endocrine gland, and it is mainly present in the front of the neck, front and the side of the neck, front and side of neck. Of the neck, and mainly it perform basal metabolic rate and calcium metabolism, and also synthesis of iodine. So this is our introduction, and second we will discuss the extent of thyroid gland. Extent of thyroid gland. It is hmm, it is present between the it is present between C5 to C7 and T1. It is divided into two lobes, right and left lobe. These two lobes are connected by isthmus. These two lobes are connected by isthmus, and if we talk about the isthmus is present between the second and the fourth tracheal rings, and the lobes are present between the middle middle of thyroid cavity and the fourth or fifth tracheal ring. Here we can see the diagram. So this is our thyroid gland. This is our thyroid gland, and it is present between the middle. It is present between the middle of the thyroid cartilage and the fourth or fifth tracheal ring. This is our two lobes, and it is connected by the isthmus. This is isthmus. Now we will talk about the capsule of thyroid gland. So there are two capsules of thyroid gland. First is a true capsule, and second is a false capsule. So the false capsule is the outer one. False is the outer one. It is derived from the it is derivative of pretracheal layer. It is derivative of the pretracheal layer of the deep cervical fascia. It is a derivative of pretracheal layer of the deep cervical fascia. And if we talk about the true capsule, it is a Peripheral condensation peripheral condensation of the connective tissue of gland. So if we talk about the capsule, this is hmm, this is our capsule. This is a false capsule, which is outer one. False capsule, which is outer one, and this is our true capsule. And in true capsule, there are some venous plexus present. So when we remove thyroid gland, which is known as thyroidectomy, if we remove thyroid gland, we have to remove the true capsule also. Otherwise, hemorrhage will happen. And if we see the prostate gland during prostatectomy removal of the prostate gland, we have false capsule and a true capsule, and in between this is the venous plexus. So when we remove the prostate, we have to the two capsules are left behind. The two capsules are left behind. Or in thyroid gland, we have to remove the true capsule also because the deep venous plexus is present in the true capsule. Now we will discuss the relations and parts of thyroid gland. So in thyroid we have one apex, second base, and if we talk about the surfaces, we have three surfaces: uh, the lateral surface, medial, and the posterolateral surface. And if we talk about the borders, there are two borders: anterior, uh, anterior and the posterior. Hmm. 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 So if we talk about the relations in apex, there is this is our thyroid gland, and on the posterior side it is thin. Posterior side it is thin, and the inferior part it is thick, and the ligament of Berry, suspensory ligament of Berry is present. This is suspensory ligament of Berry. And if we see in diagram the back side of the thyroid gland, we have two tubes. First is our esophagus and second is trachea. Esophagus and posterior we have two tubes, esophagus and the trachea. Let's discuss the relations of the apex. So apex is attached to the first sternothyroid muscle. The second we have superior thyroid artery, and superior thyroid artery is a branch of external carotid artery. And in relation to superior thyroid artery, we have one nerve, recurrent laryngeal. Now, these three things are attached on the apex. If we talk about the base is attached with the attached to the inferior thyroid artery. Base is attached to the inferior thyroid artery, and one nerve is present. One nerve is present, external laryngeal nerve. On apex we have recurrent laryngeal nerve, and base we have external laryngeal nerve. And if we talk about the surfaces, first on the posterior lateral side.
डायग्राम में समझाओ ना।
डायग्राम नहीं इसका
है?
नहीं है डायग्राम इसका।
कोई डायग्राम है ही नहीं।
Posterior lateral surface we have carotid sheath. Carotid sheath, and the contents of the carotid sheath are first.
डायग्राम में दे रखा है।
नहीं. First are the common carotid artery. Second, our internal jugular vein. And third is vagus nerve. So posterior lateral surface, we have carotid sheath, and the contents of the carotid sheath are common carotid artery, internal jugular vein, and the vagus nerve. And on the lateral surface, we have four muscle attachments. So first is a sternothyroid. Second is sternohyoid. And third is a superior valley of omohyoid. And the fourth muscle is a sternocleidomastoid. Sternocleidomastoid. So in this diagram, we can see the lateral attachment of the thyroid gland. This is our sternocleidomastoid muscle, and this is our sternothyroid, and this is our sternohyoid muscle. On both the sides, these are the attachments. And the superior value of the omohyoid is this. And this is our posterior lateral surface. This is carotid sheath, and in this carotid sheath, the contents of the carotid sheath are, this is our vagus nerve, yellow color vagus nerve, and this is blue in internal jugular vein. On both the sides, we have two carotid sheaths. First is internal jugular vein, and red में our common carotid artery, and this is vagus nerve. So we have discussed the lateral surface, posterior lateral surface. Now we will talk about the medial surface. Third, medial surface. On medial surface, we have two tubes, two nerves, two muscles. Tubes we have esophagus, and second is trachea. Muscles we have cricothyroid, and second is inferior constrictor. And two muscles we have. This is muscle, and two nerves. Nerves we have recurrent laryngeal and external laryngeal nerve. So two tubes, two muscles, two nerves. Two tubes are esophagus and the trachea, and two muscles are cricothyroid and the inferior constrictor. And two nerves are the recurrent laryngeal and the external laryngeal nerve. So these are the relations, and if we talk and the borders are remaining, we have two borders, anterior and the posterior borders, anterior border and the posterior border. Anterior border is attached to superior thyroid artery, and the posterior border is attached to inferior thyroid artery and the parathyroid gland, thoracic duct, and there is an anastomosis between the posterior branch of superior thyroid artery and ascending branch of inferior thyroid artery. So in diagram we can see there is a anastomosis. This is superior thyroid. This is superior thyroid artery, which is a branch of the external carotid artery, and we have this is divided into anterior branch and the posterior branch. Here, anastomosis occur between the posterior branch of the superior thyroid artery and the ascending branch of the inferior thyroid artery. And inferior thyroid artery is a branch of thyrocervical trunk. This is thyrocervical trunk. Inferior thyroid artery is a branch of thyrocervical trunk, and thyrocervical trunk is a branch of subclavian artery. So here anastomosis occur between the posterior branch of superior thyroid artery and the ascending branch of the inferior thyroid artery. If we talk about the arterial supply, this is our fourth heading. Relations and fourth heading. Fifth, we will talk about arterial supply of thyroid gland. There are four arteries. First is the superior thyroid artery. Second is inferior thyroid artery. And third is the lowest thyroid artery. Fourth is accessory thyroid artery. We can see in this diagram here superior superior thyroid artery. Superior thyroid artery is in relation with the external laryngeal nerve, and it is a branch of the external carotid artery. And the inferior thyroid artery, which is a branch of thyrocervical trunk. and which is a branch of subclavian artery. So here an osmosis occur between the posterior branch of the superior thyroid artery and the ascending branch of the inferior thyroid artery. So we will discuss the two arteries, superior thyroid and the inferior thyroid. And there are some branches of the inferior thyroid artery which supply the other surrounding of the thyroid gland. Now the third artery, which is our lowest thyroid artery, which is our lowest thyroid artery. It is present in the it is present in the 3% of the individuals. 3% individuals only. It is present in 3% of the individuals. And fourth, sixth heading, we have talk about the venous drainage of thyroid gland. Same, we have four veins: superior thyroid vein, middle thyroid vein, inferior thyroid, third is uh, third is our fourth thyroid vein. This first, second, and the first, second, and the fourth one. These these drain to internal jugular vein, and this third drain into left brachiocephalic trunk. This drain into left brachiocephalic trunk, and this superior thyroid vein accompanies the superior thyroid artery. It is present in the upper lobe. It is present in the middle surface, and this is present in the lower lobe. And four thyroid arteries present between the middle and the inferior thyroid vein. Four thyroid vein is present in the middle and inferior thyroid vein. So this is all about our thyroid gland.